So I think it's time. I thought about this actually last week because it's been tough. It's been tough, and I thought last week we probably are going to be heading in that way where we need to talk about this, FIP and FFRC. So I think the mods are going to pause the chat. I kind of got a little windy and I wrote things down because I wanted to make sure it was clear in my head of what I wanted to say. And the first part of this is just about FIP. It's just, many of you already know all this stuff, so I'm probably not telling you anything that you don't already know, but some of you may not know. The ending part of it is more in regards to FIP and FFRC. And then the mods will unpause, and I will, to the best of my ability, answer as many questions as well as what I can. And you can ask what you want. You know, I'm not. Oh, Elsie, gosh, you all right, girl? See, I moved this thing out and she wasn't expecting it. I'm not a dodger of hard questions, so it's okay to ask things. All right. So, FIP, and you already know, it stands for feline infectious peritonitis. I am not an expert in this, but I have had a lot and too much experience with it. I understand there's a lot of talk going on about FFRC and FIP, and that is fine, and I know that that shows your concern. So let's address this right here openly and honestly. FIP is a lethal and incurable disease that's made worse by its difficult diagnosis. FIP is difficult to diagnose, not possible to treat, and almost always fatal. This dreaded disease sends chills down the backs of rescue centers, shelter people, and catteries. Truly, there are no three letters that have the power to strike fear into the hearts of cat lovers than F, I, and P. It is the most dreaded disease in veterinary medicine and a big threat to a cat's health and survival. There is not much known about this disease, which makes it even harder. There are a few things known about it, but there are far more questions than there are answers. Now, as we get into this, pay attention to more of what it says we don't know the answer, or the negative part about this, because that's why FIP is so maddening. And a lot of this is things that I've learned simply by having, unfortunately, FIP kitties here. What causes FIP? And as you know, FIP is a virus. It's a common strain of the coronavirus. All cats have the coronavirus in them. It's what the cat's body does with that coronavirus that makes all the difference. There are two types of this virus, which cannot be distinguished from each other in lab tests. One type does not cause the disease or is only mildly virulent. This infection with this disease does not produce any signs other than maybe a little mild diarrhea. The other type is virulent. This is the cause of FIP. It is believed that FIP occurs when the corona mutates to an active stage of FIP in the cat. What causes this mutation is what is so maddening. We don't know. So what that means is FIP develops when a usually harmless strain of coronas mutates in a cat in a way that gives the virus the ability to replicate itself in some of the cat's white cells. And again, why it does this, we don't know. When the immune system mounts a defense against the invaded white cells, the immune system ends up damaging its own protective cells and tissue. The result causes damage to multiple systems at once and ultimately leads to death. Cats in multiple cat environments are at a much higher risk for corona infection than solo cats because they are more likely to be exposed to the feces of infected cats. it wasn't until kind of recently that they even put that part, 2 and 2 together, that there is the one common trait that they are finding is that it can spread through the feces, the stool. How is the virus transmitted? Corona, FIP, can be found in the saliva and stool in infected cats. FIP may possibly be transmitted across the placenta as well. The significance of this is not known yet. The FIP corona can live in the environment 3 to 7 weeks, but after 3 weeks, the number of the virus particles present is probably too small to cause infection. So 1 to 3 weeks is the biggie. Many disinfectants will kill the virus, including bleach, which is what we use here. FIP most frequently strikes young cats. It's a quiet disease at first. It will cause weight loss, poor appetite, and deterioration of the body condition. There is no proven treatments for the condition. Diagnosing FIP can be very challenging. One of the things that we have learned over time too is the FIP wet. You know, we can tap the tummy and check that fluid that we get. And that is a little bit easier to diagnose than the dry FIP. There are 2 types of FIP, the wet and the dry. Dry FIP develops areas of inflammation called granulomas. The granulomas can develop in the abdomen and in other areas. All dry FIPs, cats, if they live long enough, will develop into wet FIP, if they live long enough. Wet FIP causes damage and leaking blood vessels in the abdomen or chest. The abdomen or chest can fill with fluid, and breathing can be difficult. Wet FIP tends to develop much quicker, faster than the dry. Diagnosing FIP is a challenge. The condition is often diagnosed based upon clinical suspicion when a young cat develops unexplained symptoms consistent with FIP. They may have changes in their blood cell lines and the blood protein levels. Blood tests for coronavirus antibodies may offer some insight into the diagnosis, but the blood test cannot differentiate between the 2 kinds of coronavirus. The only 100% way to diagnose this is truly through a necropsy. So many times when a cat goes into the vet's office and they have a multitude of problems and they can't find a real reason of what the problem is and they've ruled out everything else, many times they will then say it must be probably the dry FIP. But remember, you can't have a 100% diagnosis without a necropsy. As was said, it's difficult to diagnose FIP. In an attempt to try to make the best diagnosis that can be made while the cat is still alive, there are a few criteria that can be followed. Low lymphocytes, positive corona test, elevated globulins in the blood. And as you can see, testing is not made easily. Despite the claims that are made by some labs and test manufacturers, there really is no current test that can distinguish between the good and bad coronavirus. It used to be, and we got in a major big argument with a local vet here many years ago because all cats that came in wasn't feeling good. He would do a corona test. And if it was positive, he would say, your cat has FIP. We suggest euthanasia. And he euthanized one of our cats. Well, we got that cat back, and we had a necropsy done. It was not FIP. It was diagnosed. It was definitely not FIP. And so it has become more of the attention to vet offices that even though they say there's corona, that doesn't, all cats carry corona. It doesn't mean that it's the bad corona. I mean, it could be, but it doesn't always have to mean that. How is FIP treated? There is no cure for FIP. A survivor of FIP is very rare. Cats can be given supportive care and possibly extend the life for a short amount of time. Because the dry form of FIP progresses more slowly, cats with this form can sometimes live longer than those with the wet form. Cats with FIP can be treated with prednisolone. This sometimes gives a bit of relief to the symptoms for a short period of time. Other supportive care can be appetite stimulants, antibiotics, vitamins, fluids, quality nutrition, sometimes draining the chest or abdomen cavity. If the cat becomes clearly distressed, however, euthanasia is the most humane approach. Which cats are more likely to develop FIP? As you would imagine, the cats most likely to develop it are those with the weakest immune systems. The largest number of FIP cases occurs in young cats. FIP is rarely seen in cats between 3 and 10 years old. However, starting at 10 to 12 years old, the immune system of these older cats apparently decline, making them more susceptible. Now, I do have a little issue with this, where it says those with the weakest immune systems are those most likely to develop. I mean, there's so much of this that we don't know. But, you know, think about some of these cats here. Look at Trucker, who has a very bad immune system. Canby has a bad immune system. And they didn't get it. They did not get it. You know, so it's just so difficult. It all sounds pretty hopeless, doesn't it? Truthfully, it is indeed very hard for me, and I know it's hard for you. Up until last fall, we only had to deal with the FIP. There are so many studies going on in regards to learning more about this horrible disease, but it's still a disease that raises its ugly head at us and has very few real concrete answers. Some changes have been made in the FIP world, though. FIP is still thought to be a disease that is caused by the mutation of the coronavirus. This means that for some bizarre, unknown reason, that coronavirus that's in all cats changes from good to bad. It was thought that there was no correlation or transmission between cats. So we didn't have to worry about this particular disease in that respect. And we used to say that that was the only good thing about this disease, that, you know, like leukemia and FIV, we would just have to be, we just can't have that in here. FIP, the ones that we were suspicious of, this is years ago, we just let them mingle. And we never, ever had cases at that time like what there is now. I'm going to just stop for 1 second here, and I just don't want to lose my place. I know people, too, are saying, well, we're hearing more about FIP. Everywhere we turn, you know, we're hearing more. This cat has it, that cat has it. You know, folks, FIP's been around, honestly, a long, long time. It has been called more to the attention of us here because we've dealt with it a little bit more now, and so you all are aware of it more. But also the studies of it is being more published, and vets are much more in tune to FIP, the sick cats that come in. So it's more known out there now, but it's been out there a long, long time. It's been out there as long as what probably leukemia and FIV has been. It's just that we are paying more attention to it, and the doctors and the universities are doing more and more with it, so we are noticing it more too, I believe. Let me back up. So FIP is thought to be a disease that is caused by the mutation of the coronavirus. This means that for some bizarre, unknown reason, that coronavirus changes from good to bad. It was thought that there was no correlation or transmission between them. So we didn't have to worry about this particular disease in that respect. But to be truthfully honest, I do not believe that anymore as the whole truth. We have seen it here at Ffrc, a whole litter getting FIP. This to me shows a horizontal transmission of FIP. We have seen this past fall, where we had 4 unrelated cats get the dry form of FIP. This has to also be a horizontal transmission. And to complicate things more, all 4 of those cats showed very different symptoms from one another. Except there was one symptom between 2 of them. 2 of them had neurological problems. I know there is a worry out there among you about FIP and FFRC. Please, it's fine and it's healthy to talk amongst yourself. Just please be sure that your facts are right. The worst thing anyone can do is to speculate without knowledge behind it. So, what can we do here at FFRC? We learned a few things about this from this past fall. Remember when Fancy arrived? I said right from the start something wasn't right. We treated her and medicated her, things seemed better, and then she plummeted. In the future, any cat that does not seem right will not be put in the general population. Their quarantine time would be much longer than normal. Another good way to help is to keep litter boxes extra clean. Here at FFRC, we are very good about this, but we will be stepping that up even more because we know that that is a source of contamination. Making sure we continue doing our second FIV leukemia test. Many of these cats that have leukemia or FIV that didn't show up on the first test, if their immune systems have been really compromised and they have come down with FIP also, their second test may show a positive FIV or leukemia, and that's just an indicator of their immune system. The bottom line is observing, observing, and more observing. Cleaning is also important. As our vets have said, we probably would have experienced many more diseases here had it not been for the good cleaning. But what else can we do? Please remember, we do not normally get the cream of the crop here at FFRC. We give it our all to help all the incoming cats to feel good and to love, and to feel love. I know there's a worry out there in our viewer audience. Should you not adopt from FFRC? Whatever you decide, please at least don't criticize us. We are a rescue. Did you know that there are at least 40 different viruses that cats can get? Many of these come in through our doors. FFRC can do a lot of good things. We have done this long enough to know how to treat so many awful things. We know how to make the combination of antibiotics work. We know how to help those with colici and the herpes viruses. We have our protocols from our vets for so many of the bad things that come in through our doors. But give me a cat with FIP, and I can't even help a little single bit. The biggest thing now, what we have to do, is stopping it at our door before it can spread. I know right now that there are a few cats out there that have been adopted from here that are sick and possibly have FIP. For this, my heart terribly aches. Please know that I would never ever let a cat out of here, out of our doors. If I had one split hesitation of their help, I would not do that. Knowing that knowing that FIP is such a horrible thing to figure out, what do? Do we stop taking cats in? Do we just shut our doors? Do we not take in any more pregnant cats? Do we not take in any more kittens unless they're 8 or 10 months and older? Do we put all the cats in cages? Or maybe put 4 or 5 cats in a room area and then take no more when we're full? Do we euthanize all cats that come in that appear off? What do we do? How will this year be different? All I can say is that I will try my best, and I mourn deeply with the families that have lost a cat to FIP. This is one thing I cannot fight. I understand your worries and your concerns. Please know that I am always open to discussions. I'd rather meet something head-on than to think people are talking and possibly not having the correct info. I rarely say the word hate, but simply put, I do hate this disease. So, I surely don't know all the answers to FIP. There are some answers to FIP, but there's a whole lot more out there that is not known about it. I feel like we've gotten our feet wet. I do want to tell you also that our vets feel very strongly that the studies, there's two things wrong with the studies that are being done. One is that they produce FIP in cats. They can do that, and that's where a lot, not all, but a lot of the studies come from. In my opinion, they need to do cats in an environment like this where it's a natural transmission to these cats, and try to figure it out on these cats, not cats that are like fakely induced with it. And, oh gosh, I'm sorry, I lost my train of thought. Duh, I'll get back to it. It's just a really, really hard disease, and it makes me sad. I wish you guys that know me well, that when something comes in that door and it's not right, I jump right on it and I want to get it fixed right now. And with FIP, we just simply can't do that. Uh-oh, give me 1 second here. Oh, well, about our vets. So our vets agree that it's not, it used to be said, never worry about that transmission because it doesn't go cat to cat. It's only that mutation. But that they don't believe that either, same as what I don't believe that. And so I wish that they could come into our situations and really look at the real life work of rescues and figure it out from there. And Dr. Darcy, I think, is going to write up all of our case scenarios and put it out there and see what these doctors and these universities that are studying this can gather from our case in itself. They're out there. So mods, go ahead and open it up. And like I said, I am not an expert in this by any means, but if there's anything we can talk about or whatever, that's what I'm here for tonight. Thank you, Dark Cat. Thank you, Jim. Thank you, MK. I know it takes a little bit for us to catch up with you. We had snow this morning, a little bit. Still haven't had a real wintry winter yet. Thank you, Packer. Thank you, Pablo. Kogo, it's really difficult. A lot of times the kitty cat will lose appetite. Their whole body system kind of gets sluggish. Sometimes a fever. If it's the wet, their abdomen gets real big and their vertebrae will show. There's so many different symptoms that it can be. Sometimes, like what we've learned, it's neurologically. Yeah, there's contact this through handlers. It's the only way to be. You need to retire, isn't it? Yeah. The only way you only way you know 100% squeaky is by doing a necropsy. But what the vets do say is they've done like 1,000,000,000,000 tests and everything doesn't make any sense. They then might say, well, this must be FIP. But the only way to know definitively, for sure, positively, is a necropsy. But that's after death. Right now, I think I can honestly say that right now we're fine. We do not have FIP in here. Mods, can you just pause it just for 1 minute? Can you pause it just for 1 minute? This is something that I've talked to Dr. Darcy about before, is that, but remember, all cats have coronavirus in them. All cats have it. All cats have the coronavirus. But what the cat does with that coronavirus is what makes a good healthy cat or a very poor health cat. This was a discussion that we talked about before with our vets, and we used to deal a lot with our local shelter, and at one time they had gotten kennel cough in there, and the big thing was, well, do we shut the shelter down and get rid of it? Do we shut it down and get all the dogs out of there, sad to say, clean it top to bottom, and eradicate it, And so the answer to that really is, well, you can do that, but then when you open your doors up, those first 10 dogs that you get in may have kennel cough. So what do? You keep closing it and opening it and closing it and opening it? No. So we encourage them, you just keep on going, you keep your place as clean as possible, and don't let your affected dogs be with the other dogs. And it's kind of the same way, I guess you could say here. We will do a longer quarantine, but if we ever get a cat in like Fancy again, boy, Dr. Darcy and I've talked about this a lot. We had this plan of action in when we realized what was going on with Fancy. We know if they are off, if they are neurological, if they are just not improving, there's a whole list of things that I will go by, and those cats will be quarantined not to be with any other cat. Okay, Mods, go ahead, please. The ones, well, unfortunately, Kathy, unfortunately what happened was when Fancy started acting like she was better, we left her up here in this main area. And now I'm not talking your sneezes, I'm not talking like Camby, I'm not talking like the little thing that Trucker has. I'm talking majorly down and out like what Fancy was. And when she started feeling better, we did leave her up here, and that's where then the problem started, I believe. Now, talk to some vets, and they will say, no, there's no transmission like that, no horizontal transmission. Well, nobody will convince me that it's that way. I do believe that there is that transmission like that. Thank you, Orca. That means a lot to me. And we do. We learn, and we learn. Thank you, Contessa. Well, Snoopy, you have to remember that even though that horizontal transmission, I believe, is still out there, is very, very important, and that it does happen, there is still the mutation. There are still cats out there that get FIP, lives all by themselves, and no connection with any other cat, and that coronavirus, for some reason, bizarre reason that is not known, can turn into the bad corona. So, I mean, it really can help, can happen to any cat, but it's really not even though we hear about it, there's so many cats out there that don't have it. You know, I knew the vaccine thing was going to come up, and I get most of my information from Cornell and my vets, but I copied this off here about, well, okay, let me just read this about the vaccines. There is a vaccine, it's the FIP from Pfizer, has been shown in some studies to protect up to maybe 50 to 75% of vaccinated cats, but it is not effective in cats previously exposed to that coronavirus. Also, veterinarians don't currently know how long immunities last, and some are concerned that the vaccine will make future testing, it's like the FIV. If you give an FIV vaccine and then you do an FIV test, it will show positive, and it can be the same way for this. Research also shows that the vaccine appears to make no difference in catteries where there has been an FIP, since kittens get infected before they are old enough to respond to the vaccine. Yeah, Franklin, I will. I will, Connie. But do they test? The necropsy that we had done, Need to Retire, we did complete on Fancy, and she turned up positive, nose to tail practically. They take tissues from all the organs everywhere, and she was positive on every one. Yeah. When there's a cure for FIP, we will be rejoiceful. Yep. There's no way of knowing what cats will and what cats won't. Look at the kitties that unfortunately has just broken so many of our hearts lately that have come up positive. These are kitties that are, a lot of them are in that, 6 to 12, 10 months old range right now. And when they left here, they were perfectly healthy, never showed a sign, nothing. And that was working. We just can't tell. Don't know, Jim. Squeaky, how do you tell when it's time? You mean to euthanize? Is that what you mean, Squeaky? Squeaky, my opinion on euthanasia, I have done so many for people over the years, especially when we had Earth Angels. Thank you, LJ. And I would be asked, if that's your question, I would be asked that many, many times ago, many, many times. And my philosophy on that is I would rather euthanize something 10 days too early than 1 day too late. And it's always about the quality of life for the cat. It's never about us. And I always tell people that, and that is the hardest thing of all, it's not about us. That euthanasia, what you're thinking about, is not about us. It's not us as an owner. It's about the cat. It's all about the cat. Is the cat happy? Is the cat's quality of life good, or is it going to get better? Is it going to go downhill even more tomorrow? All kinds of questions. Those are hard. Yes, exactly right, Madison. I agree with that. And I know I'm missing lots of questions, and I'm so sorry. Yeah, and I think a lot of people, if you get that mindset that you're thinking of the cat or your dog or whatever, and not you of, oh, I can't live without him or her, it's totally about the cat or dog. Yeah. Cats sometimes, because of the fluid buildup in the chest and the tummy, pushes the organs into very odd positions, and that's why sometimes you can see the rapid um, breathing, and sometimes they're breathing, they're it's called what we call sucking air. It's you can see them breathing way back here instead of just centrally up here. It's because they're using all their muscles, everything they got to be able to take those breaths. Well, Teresa, my thought on the litter boxes is that they have to be kept clean. There is a lot to be said that um, that if you clean your litter boxes, like here, we try to clean them every 2 hours, that it keeps, especially the parasites, that they don't have time to do that spreading thing. FIP, you just don't want them, cats stepping in the stool and then licking it. That's why the litter boxes are hard when you have an FIP cat sharing it with another cat. People cannot get FIP, FIV, or leukemia from cats. Cannot, not. These cats, many of their diseases that they have are species specific, meaning they can go cat to cat, not cat to dog, not cat to people. And it's like them, when they get their colds, people will say, oh, I had that cold last week. You can't do that. Our colds are our colds. Their colds are their colds. We can't change them like that. Thank you, Lost Girl. It's been really hard for me because I love those cats too. And, and I feel so bad because it's so hard on those families. And it just makes me feel kind of a little guilty. Yes, ringworm can be, yeah, ringworm is one of the exceptions, but for the majority of the viruses, it's species specific. Ringworm can be spread, it's a fungus, can be spread from cat to people or people to cat. I have not heard the latest, oh, wait, on Panda. Panda, that was Val's kitty, and they did every test in the book and nothing showed up. I don't think I'm saying anything that hasn't already been said by Val, because I don't talk about stuff unless I know it's an okay thing. Panda had been tested. Val is an awesome owner. Everything they tested so much on her, nothing made sense but FIP. But I don't believe they actually had the necropsy done. And Val's just an awesome kitty mama. But you know that saying, never do harm. And it's hard because, we raised them and then we gave them, we thought in good faith that they were healthy, and some of them, have come up positive now, and those are just so hard. I know. Yep, that's right, LJ. So, I think this baby season will be here before we know it. And our incoming will be growing too. I know, Jim. Thank you, Dark. But the protocols that we set with Fancy will be written on my forehead. And I will be ever so very careful. I never want to have to go through this again. You know, we've done this. We started, actually it was September 99, although some places it's written September 2000, but I think it was actually 99. And thank you all. We've gone through an awful lot. You know, it used to set me just so crazy when we would get herpes or a corona or herpes or any of those viruses, you know, but we're pretty good at treating them now. The one that I don't like other than FIP is the ringworm, but that is not a virus, that is the fungus. But, you know, and I know catteries and I know shelters and rescues who will put the entire lock, stock, and barrel to sleep because if they get ringworm in there. It's very expensive to treat, but that's what we do. We treat. You guys all know those bottles of 100 tablets are almost $700. Takes about 2 depending on our population, but it works. You don't have to euthanize or do all those icky lime dips or all that stuff. It is treatable, and we've learned that over the years too. I don't like it at all, but it does happen, usually every fall. Oh, Snoopy, give Freaky a big hug for me. Thank you, everybody. Well, you want some good news? You know, there are some days that I get so busy that I feel like I have not been able to chit-chat with you all very much. But in my heart, I know that you guys are just carrying on and talking and enjoying the kitties, and that's pretty cool, and I like that. And I feel I'm comforted by that. So, well, you know, Madison, actually, if I see an active ringworm, I do give the chlorhexidine 4%. 4% shampoo, and it does help. What that does is it kind of stops it in the track, but whatever hair follicles have already been involved with that fungus will still fall off, but it does slow it down drastically. But we put everybody here is on a blanket fulvicin, and it doesn't hurt those that don't need it, of course, but it does stop it, and it does stop it. It's just that it takes a while for those the hair follicles then to start growing back again. Yeah, bathing is good, but well, you know what I used to do many years ago is if we had fulvicin in, I would give that kitty a bath. I'm sorry, if we had ringworm in, I would give that kitty a bath, and then 2 days later it's like, oh my gosh, there's 2 more kitties, so I would give those 2 a bath. And the next day maybe 1 more had it, and I'd give that one a bath. Well, at the end of like 2 weeks, I'd given like maybe 20 baths, and it was still going. So that's when I talked to our vets, and it was like, yes, do the baths if you need to, but get the fulvicin in them. And it just stops it so quickly. It just really slows it up and makes it end a lot quicker. And KB, you are exactly right. Yeah, sometimes it's hard. I have not heard any more, Zena, but sometimes after I've heard from cats a couple times and then I don't, I always have to assume by then it's okay, because I can't keep checking on all of them or I'd be doing that all day and night. So many of them. Oh, Maddie, that's wonderful. Isn't that so sweet? And he loves to wallow. many treatments do they need for ringworm? We do, we treat for 21 days, and I don't do it a day short. Not a day short of that. I haven't heard yet from Nemu, but I will, and that I feel really confident about. I just really felt that Mommy was a wonderful mom. No, I haven't heard from them yet, their trip home yet. I am blessed with wonderful family and volunteers and you all out there and these wonderful kitties. Well, I want to tell you something. I'm going to ask this first. I love learning. I love learning. And I learned something. Do any of you think, well, this will be a dead giveaway question. Do you think that there's more than one kind of Persian cat? Yeah, yeah. DeWitty talked me into that, Lost Girl. Oh, she's missing Fern already. So for those that are saying yes, what kind of other Persians are there? Do you know? This is quiz time. You guys are probably smarter than I am, because I'm not so smart. But what kind of other Persians are there? What do you think they'll say, Keith? Right, Cleo? Well, you all know the they call them the show Persians, with the flat noses. Well, now a Himalayan isn't a true 100%. I mean, a Himalayan is its own breed. Kim Cost, you are awesome. You answered. Yeah, Himalayan is the breed is Himalayan. But in the Persian world, yes, we have hungry Persians and sleepy and snooty ones. There is the smush face, I guess you could say, and that's described in the CFA breed standard. Well, last week, oh no, it was probably about 2 weeks ago, this lady called me up. She wanted to know if I would take her dow face Persian. And I said, I've never heard of a dow face Persian. What do you mean? And she said, well, it's a long hair Persian. Of course, they're all long hair. But she said it has the apple face. And I said, I'm going to kind of think that maybe you're more talking like a domestic long hair rather than, yeah, or a ragdoll. But she said, no, it is its own kind of a Persian. And sure enough, she's right. She sent me the info, which I loved. And I told her at that time, I said, you know what, I can't take this cat right now. I'm just a bit overwhelmed at the moment. And I said, why don't you try back in 2 weeks? So she did. That's that letter I opened up on cam the other night that I stammered on because I didn't want to say, oh, that's this cat. There is the show Persian, which is the flat face, and then there's the dow face Persian, well, here's the show Persian, as you all know, and then the dow face Persian has the round face. And you know, all Persians can come in all colors on their fur. So dow face Persian, according to the Traditional Cat Breed Association, which is the TCA, this type of Persian is considered the original or traditional Persian, and they support that position through early images of the breed displayed on their website. This Persian has a normal length nose that is in proportion with the rest of its face and skull structure, yet it still has that distinctive Persian look, just not an extreme flat face. So we have this kitty here, and it's a boy. He's 6 years old. He's beautiful, Angie says. He's white, long hair, just has that cute little round baby doll face. And Seymour is half Persian. Yeah, he's got medium hair and crystal blue eyes. And actually, you know, in all reality, you can already guess this, which one would be the healthier cat, breathing-wise. Of course, it's the baby doll one because their noses aren't smashed in there. Do you know that the Persians that have the flat face, they have the same size as nose as what Kira has or Emmett has or Farah has? Their noses are that long, but it's all squished in there. And that's why they have so much trouble. Oh, Rose. So he's here. Is Sonia on or Jenny that was here today? They helped me with the name on it. His name is Bam. And he came with the name Baby, but we've had babies. We've never had the name Bam. So his name is Bam. And he's, oh my gosh, he's so darn cute. And he's kind of hiding his head a little bit like, oh, I'm not sure what's going on. But the second you open the pen, he has to be in a pen, you know, till we get things done. He comes right out to the edge. Did he come right out to you, Angie?
No, he was hiding.
Oh, did you? If you put your hand in
there,
he
was.
He'll be right over to you.
Oh yeah,
yeah, he's really awesome. Madison, you are absolutely right. That's a people-induced flat smashed face. Yeah. BAM. Yep, you got it, Dart. Yes, he does get along with other cats. He's been with other cats. He is all white, crystal blue eyes, so handsome. I probably shouldn't bring him up yet. Jean Lynn, I would love to, but we probably better wait. He's been in a house, you know, so his quarantine time won't worry me very much, but we better wait another little bit. There's also 2 other cats back there that have been there. You guys asked me last night, somebody said, oh, do you have any new kitties? Well, until they're tested, I can't say anything. You guys know that. You know, I did have a picture of him, but I think Lynette took it. Bam, the white kitty. No, that's Dodger, yeah. So the other two kitties, the owner had to surrender him. She could no longer stay in her home, and she could not find an apartment that would allow her cats, but she tried, and the landlord found out, and she was just devastated. And so we took him, and he'll be adopted. Sudi is doing great. She's doing great. She might be out here. Oh, I see her door shut, so she might be back in there now. That's Sonia. Oh, that's good, Dutchie. Kinda, but I think that one has silver in it. This one is all white. Yeah, what happens in Thumper's room stays in Thumper's room until the tests are done. We did the test this morning and they're negative. So there's 2 cats. This grandma had died, passed away. And still, but yeah, I gotta wait on that one. So the grandma died and the grandson brought Kitty in. His last promise to her was that he would take care of these cats, and he could not take them. He just could not take them. And so they're here. One of them is Torty, and she is as friendly can be. She come out with, she chirps, and she has like a band of gold right here.
She's beautiful.
She's really, really pretty. And then the other one, though, that's a girl. The other one, though, is black and white, has the real traditional tuxie face. Oh, so cute. He's a boy.
There's only one.
Yeah, there's really only one important one. No, I cannot. I cannot. Thank you, Goosey. Thank you, Goosey. You're our friend.
Actually, they both came out.
They both came out? Well, did you pick up the black and white one?
Yeah.
Did you feel anything? I bet you scooped up then. If you feel that tummy, you'll feel this thing out. It's about that big. huge, the biggest umbilical hernia I have ever seen.
Even bigger than Sudi's?
Oh, Sudi? So, oh, way bigger, probably 3 times bigger than that.
Whoa.
I think so. So, Saturday, in addition to doing all of the spays and neuters that we have signed up, we've got to get the Torty spayed because she's old enough to go into heat, and the black and white one, these two are not named yet, has got to have that hernia repaired. And I'm hoping that we can get Sooty in too. That's a lot of more involved surgeries, and also the spays. So we gotta, I just hope we can get everything in on that day. Well, the hernia itself doesn't hurt. There's a hole there in the abdominal wall and the innards. I'd say guts, but my mom always says, don't say that word. So the intestinal tract slips down in that. And it's all fine and dandy as long as it stays put. But if that twists, then that's bad. That's got to do surgery right now. So we keep track of that. A black and white short hair cat, traditional tuxie look. Yeah, we don't want it to twist. I think, Mish, they're probably 7 months old, maybe. They're really nice. Thank you, Dutchie. Yeah, probably about 7 months old, I think. All right, I think that is all I have. Yeah, you know what I say sometimes, Stinky, to really bug my mom, and she laughs and laughs, but she always, you shouldn't say that. I always say, oh, there's gobs of guts there, Mom. Those are her 2 words she doesn't like. Oh, I love my mom. The kitties don't have, those 2 don't have names yet, but the white baby doll Persian is Bam.
Is what?
Bam, B-A-M. Yeah. Thank you, Mish. I was wondering about that. Thank you. Okay. Oh, yeah. Don't want it to twist. Well, thank you all. You know, I have great respect for all of you. Are we short on anything? Visits from you guys. Yeah, I did. I did get hers.
Here's your phone that Emmett's guarding
Emmett's
for you.
trying to guard. I know we were a little bit low on juice. Jenny brought us some, but I can get those. I did get a Walmart gift card I can use on that. But I have to go check. I don't even think I did an inventory check last week, now that you say that. Oh, we don't need kitties, Wolfat. Not yet. I told some people today, I said I want to get through this Saturday and then get that first transport under our belt. And but I think the kitties will hold off for a little while yet. I'm hoping so yet. What my goal is to get them all neutered. Get them all neutered. Yes, appetizers and baby food is always needed. Our bleach supply, I think Tenny brought us 9 bottles, so that's cool. And for those of you that heard about our doggone water problem again, our hot water, we've got hot water again. They came and pretty much put all new innards or guts, innards in the hot water heater. It's only 3 years old. They do not want to replace it. It's supposed to last 20 years. That one is. So I think this will do it. Vinegar doesn't sterilize, but it does help neutralize some of the odor in there from kitties. Thank you, Goosey. Thank you. That's the Saturday, you guys. We got our big surgery day. Oh my gosh, wow, Wolfpatch. Yeah. Hate to think of it already beginning, because I want to do a whole bunch more spays and neuters. Yep. Lynette and I are trying to figure out when they've invited us up there to Humane, Ohio. I wanted to go so bad this week, but I just don't have time. So I'm hoping next week we can. We need to do that. I know, something's always happening here, isn't it? Always. All right, you all take care. I so appreciate you all and respect. Love you all. And we will do our doggonedest bestest to take care of things here. All right, nighty night all. Gotta go tuck my mom in for the night.